Hi, and welcome to our presentations on cervical infections. Specifically, we are going to look at gonorrhea. Now, when we look at these cervical infections, an important thing that we must note is that most common causes of cervicitis and infections of the upper reproductive tract usually differ from those that most commonly cause infections of the lower reproductive tract. However, we find that Neisseria gonorrhoeae and Chlamydia trachomatis are the two most common organisms that cause cervicitis, and about the only organisms shown to cause mucopurulent cervicitis in women. Now, there are others or other organisms which also, may cause these cervicitis. They may include the HSV or the herpes simplex virus, and these ones cause herpes lesions or a white plague that resembles, cervical cancer. We also have the human papilloma virus, which, when there is an infection, may lead to the formation of condyloma. And depending on the subtype of the human papilloma virus, we may also find it being the etiology or the cause of cervical cancers in these women. Other organisms may include Mycoplasma genitalium, as well as organisms which may cause bacterial vaginosis, which is the Gardnerella vaginalis. As I described or I explained in my previous tutorials on bacterial vaginosis, we saw that douching plays a major role in causing some of these infections in women, and so frequent douching may also cause cervicitis in women. Now, when we look at gonorrhea, the causative organism is Neisseria gonorrhoeae, and this is a bacterium which is also known as gonococcus. Now, the gonococcus is a diplococci, and so it's different from the ones which cause meningitis. Now, with the epidemiology of gonorrhea, we find that most cases occur in between the ages of 15 to 24 years of age, with the highest rate between the ages of 20 and 20 years. It has an incubation period of 3 to 10 days, and about 50% of all patients, or the women who have this gonorrhea, are asymptomatic, meaning they are carrying the organism. However, they are not showing any symptoms, and so they can keep spreading from one sexual partner to the other, if they have multiple sexual partners, of course. Now, the transmission, as we've just explained, is through sexual contact, and the male to female transmission is about 80 to 90%, as compared to an estimated 20 to 25% of female to male transmission rate. This usually is seen after a single sexual encounter. Now, the common site of infection is usually the anal canal, the urethra, as well as the oropharynx and the Bartholin's gland. Now, the difference in the transmission between men and women is most likely related to the type of epithelium which which the bacteria is exposed to in the different sexes. As we know, in men or in males, the external surface of the penis is primarily keratinized epithelium, whereas when we look at the female or the ladies, they receive primarily contact with mucosa of the vagina, and this mucosa is non-keratinized epithelium. as well as that of the cervix. Another important point, which makes this transmission from men to women so high, is that the male ejaculation increases the amount of exposure time in women. And this is the main reason why we recommend the use of condoms and other barrier methods of protection, as an exceptional prophylactic measure against gonococcal transmission. Now, when we look at the risk factors which are involved in the cause of gonorrhea, we say that low socioeconomic status and also urbanization plays a major role in the cause of gonorrhea. This is because low socioeconomic status and usually isolation makes people become more vulnerable to sick behaviors like unprotected sex, especially with multiple sexual partners. And urbanization, statistics have shown that cities act as a hub for sex trade, and urban poverty, has been linked with high rates of unwanted pregnancies as well as sexually transmitted infections, including, HIV. Now, the non-white and also non-Asian race ethnicity is also at high risk of, developing this gonorrhea. Basically, the explanation to this has got to do with some stress and other factors which is not, well, explained. Now, early age of first sexual activity has also, been associated with sexually transmitted infections, specifically and also including gonorrhea. And people who also indulge in illicit use of drugs, are also at risk of developing sexually transmitted diseases, including gonorrhea. Then, if you have history of sexually transmitted infections, then your chances of acquiring or getting gonorrhea is also very, very high. Now, we encourage the use of condoms and also diaphragms and spermicides, because it helps to decrease the risk of transmission of these microorganisms to cause gonorrhea. Now, let's quickly look at the symptoms or how gonorrhea presents in women. Now, mostly women with gonorrhea are asymptomatic. But when they begin to show symptoms of the disease, the vaginal discharge is usually greenish colored and it's offensive and it's pus-like, discharge. And usually it causes, the genital area to become inflamed and edematous. So what we see is sometimes it is even possible to milk, some of the pus from the Skinner's duct, within the vulva. Now, we also have urethritis being, a common presentation, as well as dysuria being a common presentation. Urethritis being, inflammation of the urethra of, the ladies, as well as painful, or pain during urination. Then we may have Bartholin's abscess, and this Bartholin's abscess may even proceed to a disseminated, infection. And this disseminated infections usually begins with fever and, erythematous macular skin lesion. And if left untreated, may lead to this complication that we call tenosynovitis and, septic arthritis. And so, to students who are watching this, if you read, the question and it tells you that the patient, had some greenish discharge, or had some vaginal discharge, and after some time complained of tenosynovitis as well as septic arthritis, it should take your mind to the fact that this patient may have suffered gonorrhea, and this is a complication of gonorrhea. Now, if you look at the diagram on the right, you can see the discharges that I talked about. If you look at the male discharge, is somehow greenish yellow, discharge, and if you look at the female, also you see some pus-like, discharge from, or within the vagina. Okay, and also if you look at this, this is actually a complication of gonorrhea in neonates, what we call ophthalmia neonatorium. And so this is when mothers who had gonorrhea were not well treated, or were not treated, and so they gave birth, and as the baby passed through the birth canal, came into contact with vaginal secretions which had this Neisseria gonorrhoeae, causing these eye infections in the neonate. Now, how do we diagnose gonorrhea? Now, we use specific nucleic acid amplification test to diagnose gonorrhea, and over here we use it because it is highly sensitive and specific, and it also provides an increased female specimen testing options. So we are not limited to only vaginal secretions. We are able to even take specimen from the urine, the endocervical swab, as well as vaginal swab, to help us in isolating the Neisseria gonorrhoeae. Now, when we do the nucleic acid amplification test, we look for the genetic material of gonorrhea. Now, we may also use culture, and with culture we do gram stain, and what we use is a media known as the Thiamartin chocolate agar, which is specific for Neisseria gonorrhoeae. Now, what we do is that we take the swabs from the vagina or the cervix, and as well as the urethra, the rectum, and even the mouth of these patients. And what we do is we try to culture these specimen. We culture them, then we through this Thiamartin agar, we apply them on this plate. Then, since what we are looking for is the Neisseria gonorrhoeae, we find that a lot of other microorganisms may grow on these on this Thiamartin chocolate agar. And so, in order for us to isolate the Neisseria gonorrhoeae, what we do is we add some antibiotics to these media. And amongst these media, or amongst these antibiotics, we have the vancomycin, the colistin, the nystatin, and sometimes we also use trimethoprim. Now, when we do this agar preparation facilitates the growth of the Neisseria gonorrhoeae, whilst it also tries to inhibit the growth of other bacteria and fungi. For example, when we add colistin to the media, we know colistin is a broad spectrum gram negative antibiotic, and so it will kill all the gram negative rots which may have grown on the media, such as the Pseudomonas and the E. coli. When we add vancomycin to this media, it will kill all the gram positives which are there that we don't need. Then when we add nystatin to it, nystatin, as we know, is an antifungal, and so it will kill all the fungus or the yeast, organisms which are found inside the media. And so at the end of the day, we are going to be left with the Neisseria gonorrhoeae, which we are trying to isolate. So this is how Neisseria gonorrhoeae is isolated through culture. However, the current, most popular method which is being used now is the nucleic acid amplification test. Now, let's see, before we even look at the treatment of gonorrhea, it is important that all patients with urethritis should be screened for Neisseria gonorrhea and Chlamydia trachomatis. This is a very important thing that you must remember. Now, if you look at the diagram over here, this is a photo showing how the neutrophils, which is having the Neisseria gonorrhoeae, inside it, and as you can see, it is diplococci. And so over here we have the polymorphonuclear leukocytes over here. Then we see the extracellular gram-negative diplococci, so you can see them over here as they've grouped over here. Then also we have the intracellular negative diplococci also over here. And so when in an exam, when you are given this diagram, it's you should be able to identify that this is diplococci and specific for Neisseria gonorrhoeae. Now let's quickly look at the treatment options that we have for the treatment of gonorrhea. Now, treatment for uncomplicated gonorrhea infections is specifically ceftriaxone with 1 gram of azithromycin. The cefixime is an alternative to ceftriaxone, but ideally, the drug of choice in the treatment of gonorrhea is the ceftriaxone with 1 gram of azithromycin. Now, the addition of azithromycin to this therapy is to both potentiate the treatment of these cephalosporin, that's the ceftriaxone, as well as to treat and try to subside any co-infection with Chlamydia trachomatis. It is therefore recommended that we have dual treatment at all times when we are managing Neisseria gonorrhea in all patients, including the patients who even have negative test for chlamydia. We must use ceftriaxone in combination with azithromycin. We can also use crystalline penicillin for these patients, and usually when we give these crystalline penicillin, we give it alongside with lidocaine for intramuscular injection, and we add this uricosuric agent known as probenecid. This probenecid is given alongside this crystalline penicillin to help us slow the excretion of the antibiotic. This probenecid is how it works is it lowers high levels of uric acid through trying to increase the urinary excretion of uric acid, and so it is used to treat gout and gouty arthritis. Now, when we give 1 gram of this probenecid together with penicillin, it acts to potentiate the effectiveness of this drug by way of slowing the excretion of the antibiotic from the system. This is why we add probenecid. Sorry, this is why we add probenecid to the penicillin. Now, the other things that we must know is that we need to treat the sexual partners of these patients, because once, sorry, because once the woman is infected and you do not treat the sexual partner, even if you treat or if you manage this woman successfully, the husband will reinfect this woman, as we've seen that it's about 80 to 90% transmission from men to women. Then let's quickly look at the complications and preventions of this infection. Then what we see is that it is likely to cause abortion and even stillbirth in most of these women. And there is also going to be generalized pelvic infection and also even future infertility, which I'm going to explain or show. So it is very important that we pay or we focus our attention on the preventive measures of gonorrhea, because of this grave complication of future infertility. Now, there may also be fetal transmission during delivery if the woman had gonorrhea which was not treated before delivery, and so these patients or these neonates may have what we call the ophthalmia neonatorum, and this disease can even cause blindness in the neonates if care is not taken. Now, the infant must thus be isolated, and we must treat this infant with penicillin, eye drops, as well as systemic penicillin to get rid of the gonococcus from the baby's circulation. Now, how do we prevent this? We need to reduce the number of sexual contacts. Then we also need to also use condoms, diaphragms, as well as spermicides, to decrease the transmission of, the infection from one partner, to the other. Now,